Hello and welcome, my Zenith nurses, to the Zenith Nurse Podcast. Today we have Sue Sierra Lupe. Thank you for being here today. She is a healthcare administrator and advocate, and she had started the Occupied Medical Clinic in Oregon. Sue, tell us about you.
Hi, it's good to be here. I appreciate coming on. This is a exciting topic for me. I'm thrilled to talk about it. My background, is healthcare administrator. I do clinic management. That's my jam. And I also come from a background of natural medicine. I'm a clinical herbalist and have a background in dietary care. Um, Botany is a big exciting topic for me too. I've got 8 books printed about clinical herbalism that you can get on Kindle. So that holistic preventative care aspect, that's really a big part of my life and my thinking. And when I was part of the Occupy movement back 2000, 2012, 2013, gosh, it seems like it's been so long ago, then myself and a couple more people, we put together a little first aid tent in the park as part of the encampment. And we had a lot of people that coming in for help because we didn't have urgent care back then. If people wanted help, they on a Sunday, their only option was the emergency room. And we didn't have OHP, which is our Oregon health plan. That's kind of a small version of a healthcare for all. They started with seniors giving free insurance coming out of our taxes to seniors, and then they expanded it to youth and then people in economically vulnerable situations. And they've expanded to people with chronic conditions as well. So we have a highly insured population here in Oregon, but we didn't have it at the time. So we had a lot of people that were coming through, not just to get first aid, but we had prescribers there for free. They were getting help for their chronic conditions as well. Diabetes, this is back in the day, walk out with a prescription for their diabetes management. And we also started learning how to work the system with some of the networked allies, which wasn't encouraged as much, and getting them in contact with places where they could get those prescriptions filled for free, or networking with other service organizations that had other supplementary care for folks. And then it expanded where, like, I wrote a grant for a bus, so we became a mobile unit. And then we just regularly, as the Occupy movement became much more minimal, then we got stronger. What we ended up doing was setting up every Sunday for 4 hours in the park, and we saw whoever. The only registration was that we were getting people's information as they wanted it to be presented to us. So if someone had a street name, for example, unless they were getting a prescription, as long as they were consistent with that street name, they come in, they say, "I'm Superman," because they're afraid of being caught by the cops. So we just like, okay, Superman, come on in. We'll have you see a doctor now. And the herbal component of it really caught fire. I mean, it was people were very excited about that. It was nice having options, because if you get St. John's wort, that's something you can get in a grocery store, whereas a prescription, it might be a problem. And then the side effects were different. So the kind of medication that I was passing out wasn't causing nausea. It was more like symptom control, which was really nice for people to have as well. And it seemed like many of the symptoms that people had was not necessarily a symptom of their medication. It was a symptom of poverty. So they needed some assistance with that. Also, when it comes to being unhoused, for people that were unhoused, there's a lot of medication that had a lot of street cred and would get stolen from them. So people would get rolled for their meds when they would come out of a pharmacy. And that wasn't true for their herbal medication. So there were several reasons why that was an option. And we were working with doctors. So of course there wasn't that pressure of, oh, those herbalists are diagnosing. No, we absolutely are not. That wasn't what we were doing in the slightest. So it was a nice project. And then it expanded to things like we had clothing for people. We had food. Food Not Bombs came in and they set up a little table and they had hot food for people. And we had a variety of survival supplies, toothbrushes, blankets, backpacks, socks, all kinds of different things. Sometimes we'd have people come in. We had a dental van that came in. Occasionally, we had a vet that passed out free parvo vaccines for the puppies. And sometimes we had people that would sign people up for different programs that were available. And we had social workers that came in to do some conversations, have some free conversations with people about mental health issues or domestic abuse, all kinds of different stuff. It was great. And that's what healthcare for all looks like when you're doing it on the wing. Nurses were a big part of our program for people that are unhoused. Trench foot is a giant part of their winter every year. So we had a lot of foot care that we did, foot soaks, and the nurses were excited to have the herbs as part of that because the water that people were soaking in, it made it smell lovely. And we had antibiotic herbs that we would put in there to help with the foot sores. But of course, there was always the first aid aspect of it. But just the fact that someone could sit in a tent and get their feet warmed and cleaned and their wounds treated and be honored, I think that was a big part of being a nurse. And that was a big part of our program. So we would serve like 40 people in that 4-hour period. And then for people coming into the other tent that we set up for the survival gear and the food and etc., there were sometimes 100, 150 folks in a short period of time. And I think that changed for me how I viewed healthcare for all. It went from, yeah, that'd be really great, that'd be nice, to this is a necessity. So I would also watch people after they went through this process with us and we were able to connect them with things they were able to get and maintain jobs, get housing, because it's, attitude changing as well to learn that you're worthy of care. That makes a big difference in being able to self-manage. So we saw people's lives just turn around really quickly, and they ended up going from frequent flyers to the emergency room to rarely attending at all and getting their lives back. So yeah, it's necessary.
It's so exciting to hear all this. I come from a small town in Rio Grande City, South Texas. And I didn't grow up going to the doctor very often. I grew up with medicine from home. You have a tummy ache, grandma goes outside and boils some leaves and has you drink the tea. You got something in your eye. We don't do eye drops. There's what I think is the Thai basil. They're seeds. When they dry, you put them in your eye and it collects all the dirt and you can take it out and it cleans the eyes out. If you get metal shavings and stuff like that. I didn't grow up with Band-Aids. I actually grew up with spider webs because they were a way to coagulate the area a little bit better because the coagulating factors, they make webs. Which later on when I learned that when something coagulates, it forms a web, I was like, oh, that's why they use
the proteins.
Yeah, my grandmother was very, you got to be clean. And I remember I got bit by ants and I started swelling. So she grabbed Clorox and put it in mud and put the mud with Clorox all over my hand, and now it's people do other things. But I grew up that way. And when everybody would say, you'd be a really good nurse. And I'm like, what's a nurse? Like, what does a nurse do? My mom was always a CNA and she helped make the beds and help the patients if they needed anything. And I thought that's what nursing was initially. So I became a nurse and there was a lot that we as nurses do. And we're capable of so much to be there for the patients. We approach things in a very holistic approach. You mentioned that there was someone that would come and give vaccines to the dogs because homeless, I noticed a lot of them, their friends are their dogs. That's their social connection to feel like they have some sort of purpose. I live in Houston, so sometimes you'll see them with their dogs. And I used to work at Bentob, so we'd get a lot of people like, I just need to get back to my dogs. Like, we'll get you to where you need to go to. So I thought like that.
Dogs are the walls around them as well.
Yes, they're protectors and they'll find a way. I remember when it was like, I just need duct tape for my tent. And it's like the simplest of things that a lot of us don't think about those kinds of things. This person is, I'm just happy to have a tent.
Yeah, they're doing the best they can with what they've got.
Absolutely.
And that's part of your survival. For instance, I'm a cancer survivor. And, I've said many times, I'm grateful that I had cancer. It was a wall for me that stopped my trajectory, and I figured out how to change my life for the better because of that obstacle. I don't wish it on anyone. It's
Right.
horrible.
Mm-hmm.
I don't wish being homeless on anyone, but
Yeah.
I admire how people adapt, doing the best they can in a horrifying, dangerous, demeaning
Mm-hmm.
situation. And it is impressive to
Yeah.
see what people do with it, particularly because you're comparing what some people do with it to what others. We weren't given the skills to live unhoused. That's not that's
Yeah.
that's not
Yeah.
that's not what we got.
Mm-hmm.
So they've had to completely reinvent the wheel using other people's trash
Yeah.
in order to survive. And
Absolutely.
it, I mean, we all know that the life expectancy for an unhoused person is much, much lower than for someone who's housed. You know, that we watch people, they struggle and struggle and struggle with these chronic health conditions, and then they get housed and I don't see them anymore. Those health conditions were completely related to exposure, to being demoralized on the street, to, for instance, during my own cancer time, treatment and recovery, I thought about one of our patients who was going through the same type of cancer that I was going through. And she would go through chemo and then she would leave the cancer treatment center and then go and recover sleeping under a bridge. I know for me, they're like, put your feet up, rest, relax, eat this kind of food and that kind of food. And when the kind of food that you have is not really the kind of food that you can choose, she would just go without food. And that's not a healthy part of your cancer recovery. Putting your feet up when you're sleeping under a bridge. I don't see how that's possible, especially when the police kept coming by and rousing her and telling her, hey, you can't
Right.
sleep here. Like
Mm-hmm.
that's sleeping is all I could do
Yeah.
when I was trying to recover from radiation, chemo, and then the surgery.
Yeah, just yesterday I parked and there's this guy under the shade. It's so nice out, right? He's under the shade on the concrete. And I'm like, he looks so cozy. My grandfather was the kind of person who didn't like to take showers. When he got old, he said, I am a tree trunk and I grow on this or whatever. Like, okay. We
Mm-hmm.
would try to kind of get him cleaned up. But one thing I remember, he grabbed my hand and he said, don't ever feel like someone like me is disgusting. I'm still a person. And it was like that really
Mm-hmm.
helped curve how I work with homeless people at the bedside. Because
Mm-hmm.
my grandfather came from poverty, or what people consider poverty. He grew up with love and maybe a community, but financially it's
Mm-hmm. If you're
different, or
lucky.
how you prefer to live
Yeah.
your life is like more different, of course. Um, but it's tough when you don't have that character or those characteristics or those experiences as an individual. Being a nurse can be quite a culture shock, going into
Yes, you're right.
settings where nurses are suddenly exposed. They want to help, and you can see that they want to help, but sometimes they don't really know how, and it takes time to develop those skills.
Mm-hmm.
um,
That's part of that trauma-informed care model, which
mhm.
is ever changing, where you're assuming that if you don't have a concept of what people are going through, then you can't truly help them. I was raised in a family that was struggling with poverty. We would have popcorn for dinner sometimes because that's all that we had. And my mom did the best of it by trying to, like, oh, we're having popcorn, woohoo. But the reality was that my daddy drank our food. All the food money went right down his gullet. So there wasn't food for us. And having his mental illness issues and stuff, we were in and out of housing. Sometimes they were sleeping in places that weren't meant to be slept in. And so I felt like I had a really good heart for that, but it was repeated homelessness, but it wasn't chronic homelessness. And that's a very different characteristic. That is starting over sometimes every single week. You go off to go get a resource and you come back and your camp has been swept. You have nothing again. I did not go through that. I didn't live in a place in which your feet would get wet all the time. I didn't live in or have a situation in which I had to drink out of puddles. I didn't have, I mean, we were a family and we weren't getting attacked. We have people that had seizures, and when like the gals, when it went around, the gal had seizures. Some of these people would just wait for them to have a seizure, and then they would kind of come to, and there'd be a guy on them. It just here's a good time. It's just, I did not have a concept of what that was like at all. So
Yeah.
it was traumatic, of course,
Yeah.
to see all the suffering that was going on, but
Yeah.
of course, more traumatic for the people going through it. And I know a lot of the patients would say, I'm fine, I'm doing okay. I'm adapting. I really am. I've
Yeah.
got my freedom. I've got whatever. I'm like, that's a trauma response right there. You are
Right.
suffering and you're
Yeah.
telling yourself that you're okay just to get through the day. I get it, but
Mm-hmm.
don't let that attitude, help you survive, but don't let it stand in the way of accepting care.
Yeah. Yeah.
That's a trap.
Yeah. Having worked at the public hospital, getting what they consider, oh, that patient is difficult. And I'm like,
Hmm.
okay, difficult to whom? Like, difficult as an individual or difficult for you because you don't understand why they're responding or reacting or asking. And they can be very needy, but it's needy from a place where I finally have a place to ask, right? Because being in the hospital setting, sometimes they get stuck in the hospital for days and sometimes they don't want to be there.
Hmm.
And they get stuck there because they have something that's wrong and they're allowed to leave whenever, but some can't even get out of bed, you
Yeah.
know? And that's tough. And it's how do you treat those things, right? I don't know if that's
Hmm.
really treatment or that's just how can we be human with those kinds of people. I mean, it's a fine line. Like for me, it was like, okay, I'm gonna, wake up every day and you're like, okay, today I want to do kind things, right? And
Hmm.
when you're a nurse, it's like being kind to those you don't understand, to be
Hmm.
kind to people who are mean and aggressive, and maybe because they're not being mean and aggressive because they're doing that at you. They just had, like you said, trauma response at survival. Like for them, that's just how they respond. But going back to the healthcare for all, yours was really focused on helping the people deep down on a level that not a lot of people have set up everywhere. You see it set up in some places, but you don't hear a lot about it.
Right.
Um, and I think that's with the Healthcare for All Learning Conference, a little bit of that vision was, well, why don't people know? I've gone to this new clinic and these sponsors and then come together and they'll have a panel discussion, but none of them are working together. Like
Hmm.
everyone
Yeah.
works separately.
Separately. Yeah.
It's like having a team and no one's really on the same page.
Yep. We are struggling so hard just to get our own job done. It does take a lot of extra work, networking and connecting with other agencies, and also trying to learn to trust some of those other agencies because you hear from the patients, oh, this person from this agency did this. And maybe that story is accurate and maybe, but we don't really know. Sometimes people are also talking about their own level of trust. The thing that they were looking for wasn't something that organization could offer. But what does that organization offer? Was it the problem that they had based on just a misunderstanding with the person, or is it a problem with the agency? There are problem agencies out there. There are agencies that I've worked with that I would never work for. And I sometimes hesitate to send people over there. But then you keep your eye on things and watch, and the agencies kind of they change leadership most of the time when there's a problem in its management. And that's me.
Yeah. Like, it's me. Like, oh no.
I'm the problem.
Yeah.
Yeah.
I'm glad you brought that up because everything I see outside of nursing is very much like everything I've seen inside of nursing. From working in a big hospital, of course, administration, then you got directors and you got managers and you
Hmm.
have supervisors. And it's like saying, okay, yeah, this nurse didn't do such a good job. Like this agency didn't do such a good job this first year because
Hmm.
then they're still learning how things work, how
Yeah.
people work. And I get it. It's just not making people wrong, but supporting those, like you said, they change, but keeping an eye. It's like a lot of work. Right now, AI is taking a turn where it's taking some of the job responsibilities. They'll review resumes. And then, of course, HR can focus. Now, we don't know if that's really going to work just yet. Some people say it's working, it's helping out, but now they're laying off people.
Hmm.
Now it's, well, why aren't we focused on getting people more geared to working with people while the paperwork gets dealt with on another level.
Yeah.
That's a chat for another time. But with the Healthcare for All Learning Conference, I was visioning a collaboration with not just companies or clinics, but also people. Like you said, you had started it in Oregon. This is something that is growing as far as a vision, and I'm slowly trying to transition as a leader slash visionary, owning that vision and really coming to trust, to open your heart. Like you said, I got to trust this agency who have heard not that great things, but I got to send them somewhere, right?
They have
Gotta
resources.
start somewhere. Yeah. I appreciate you coming on and talking about what you've done. I know you mentioned a few things, which we can talk about another time with insurance, because that's another little snag of how do you get not past it, but through it with.
Use it as a tool.
Yeah, as a tool. Yeah.
Mm-hmm. That's its own topic. Yeah. They're presenting themselves as insurance companies as tools, and they're in reality behaving like weapons.
Yeah. Yeah.
So that is its own podcast. Absolutely.
Absolutely. So that'll be for the next time. But for now, Sue, and I would love to follow up. Maybe have a little chat. I appreciate it. You have so much more experience in places I'd like to explore. And thank you for your time. If people want to maybe, let's say, reach out to you, do you have something you're working on?
Right now, I've got a couple of things that I'm shifting. Mm-hmm. We've got Trump tariffs and Doge walking around making big changes.
Right. Absolutely.
And one of the things that I know is the culture for the unhoused and for people that are vulnerable changes with the kind of support that they have. So mm-hmm. I feel like pausing things. I'm still volunteering and doing work with those populations. Things are changing very quickly, and I feel like I just need to get my hands on what is going to be serviceable for the population that I have experience working with.
Absolutely.
So when ICE comes into our community, that changes things tremendously.
Yeah.
So we have to change form. That's how organizations become unhelpful. They may have a great mission, but they haven't changed to match what the population that they're serving has changed with. And right now things are changing rapidly. And I'm not going to be that person that sets out with antique care for a modern population. That is not helpful. Because it's not about me. It's not about what I feel comfortable with. It's it's about serving the needs.
Absolutely.
Well, people could send questions through you.
Yeah, through the YouTube. Yeah, they can send questions. We're learning together, and whoever watches this video, may you learn something too.
Yeah.
All right. Well, thank you, Sue.
Thank you. All right. Take care. Healthcare for all.